Every week I typically do these Facebook Lives, short little videos to talk to you about whatever health topic is top of mind. Well, I've taken the last couple of weeks off. If you follow NBI and the NBI Facebook page, you'll notice that the last couple of weeks I didn't do a Facebook Live. And that's because I've been dealing with my own health issue. I was recently diagnosed with herniated discs in my neck. Incredibly painful. Arm, shooting pain down my arm, numbness and tingling. I was actually bedridden for almost an entire week and slowly starting to get better. An MRI showed some pretty severe disc degeneration with what's called disc extrusion into the little canal where the nerve exits the spinal cord and goes out into my neck and then down my arm. So I always like to ask the question when I'm seeing doctors or specialists, and I say, if you were me in my situation, what would you do? I think it's always great to get their perspective. So I, as an integrative healthcare provider, as a naturopathic doctor who is educated in not only research and looking at the underlying physiology of the body and how it works, but also in integrative approaches to health, I went to the conventional orthopedic doctor, and my options were a steroid injection, physical therapy, and then just yesterday reviewing the MRI, it was recommended that I consider potentially disc fusion surgery or cervical vertebrae fusion surgery, which I don't want. I didn't want a steroid injection. So a steroid reduces the inflammation and it can be incredibly helpful. It may be right for you. What I'm telling you is only my experience and what I'm deciding to do. I'm not recommending anybody do what I do. I'm recommending you discuss this with your healthcare provider. But I decided not to go with the steroid injection and started doing instead some dietary supplements, nutrients we know that help break apart that inflammation, those inflammatory molecules. Herbs, for example, and extracts that are in the joint relief product that I created, like bromelain, very powerful in that respect. I started looking at what is the disc, the intervertebral disc, made of. It's made of type 1 collagen. So thank goodness, just recently, we launched our new collagen product with types 1 and 3 collagen in it. Phenomenal for promoting healthy skin, bones, joints, and nails. But what I didn't realize at the time is it's also type 1 collagen, very important for the intervertebral disc. So I started taking that as well. I got a home decompression unit to sort of stretch my neck a little bit at home. Rest, very important. I'm going to see an acupuncturist today. I'm looking at hyperbaric oxygen as a potential therapy for me. The list goes on and on. I did some massage. I've done some cupping. So I am getting better. Things are progressing in the right direction. I'll be getting another MRI probably in about 6 months. But if you want to follow my progress and see how I'm doing and what the research has been showing, because every step of the way, if I get an idea, I'm researching it. I'm looking into the basic science and clinical trials on these approaches to see if there is a body of evidence supporting what I'm doing and what I am considering. One other thing that I'm doing in terms of dietary supplements is providing this cocktail of nutrients that are important for the disc besides just the collagen. But glucosamine sulfate is important for disc health. MSM, hyaluronic acid, things of that nature. So if you want to follow the progress, make sure to follow the NBI Facebook page. Head on over to the NBI store at nbihealth.com where you can check out collagen and get your bottle. You'll notice a difference as well in terms of your skin hydration, as it promotes healthy skin hydration, reduction in visible lines and wrinkles, healthier skin, and a lot of people have suggested or commented how much it's helped them with their joint discomfort as well. Follow the MBI Facebook page, and I'll see you again here next week. Bye-bye.